Yatin Sagvekar, consultant neurologist attached at New Vision Super Speciality Brain and Eye Clinic in Thane. I'm also attached at Kokilaben Dhirubhai Ambani Hospital, Navi Mumbai and Jupiter Hospital, Thane. So, as we all know that the National Epilepsy Day is around the corner, which is 17th of November. This video is going to be a short talk about one of the very important aspects of caring for epilepsy patients. So on this day, let us all pledge to understand, create and spread awareness about epilepsy, which can help these epilepsy patients lead a seizure-free and a normal life. So today I'm going to talk about a very important aspect of caring for these epilepsy patients, the often untalked about aspect of how to recognize the emergency situations in epilepsy. So there is a very common type of seizure that we all know, which we call it as mirgi ka daura, akdi, ya badi fit, where there is sudden jerking of limbs. There will be some head turn on one side, uprolling of the eyes. There will be frothing from the mouth, and the patient will become unconscious with tongue bite. And sometimes the patient will also pass urine or motions in the clothes. So this is the most common type of the seizure. However, there are many other multiple types of fits seizures known in medical science. But let us talk about what is to be understood when recognizing an emergency in such a situation. So, epilepsy patients are going to suffer this kind of fits or seizures. More than 90% of these seizures are self-resolving, self-limiting. They stop in around 90 to 120 seconds, that is within 2 minutes. More than 90% of the seizures will abort, will stop on its own within first 2 minutes. After that, the patient regains consciousness and becomes alert and normal in another 15 to 20 minutes. So if there is only single such kind of episode, there is, and if the patient is already a known seizure disorder patient, known epileptic, there is no need to panic excessively, or this is not a very emergent situation. So what we have to understand is when to know there is an emergency situation, so that these patients can be immediately taken to the nearby hospital to be so that emergency medical care can be addressed. So like I said, more than 90% of these seizures will last within 2 minutes. So the rest of the seizures which last beyond 2 minutes, beyond 5 minutes, are the types of the seizures we have to be careful about. And these are the kind of the seizures where there is a need for emergency treatment. So these are the type of situations which are called emergency situations in epilepsy. So this why these are emergency situations, because a prolonged seizure, a prolonged fit episode can cause a irreparable or permanent damage to the brain. The prolonged seizures can eventually cause certain chemical changes, certain changes inside the brain, which can have a long lasting effect on the understanding, memory, judgment, cognition of these patients. And sometimes this prolonged seizures or repeated seizures can be life threatening, which can have a bearing on one's life. So it is very important to understand, recognize these emergency situations. And there are a lot of ways to treat such kind of emergency situations, to avoid these emergency situations, and these measures can be taken at home, during the transit to the hospital, or even in the hospital. So we are not going to talk much about what treatment is to be given for avoiding such emergency situations, but we are going to talk about how to recognize these situations. It is important that all of you, if you know, if there is an epilepsy patient known to you, or is one of your relatives or you yourself are suffering from epilepsy, these are the things you should discuss about with your family members, so they will be alert to recognize such emergency situations. So immediate medical attention can be needed in such emergency situations to prevent any further permanent injuries to the brain. So which kind of emergency situations are we looking for in this talk? Are that if the seizures, as I told you, lasts more than 5 minutes, or if there are recurrent seizures where there is no regaining of consciousness in between the seizures. That is, one seizure occurs, maybe the movement stopped, but the patient has not become alert, patient has not become conscious. Immediately, another seizure episode starts. Immediately after that, third, fourth seizure episode starts. So these are type of seizures which can lead to a condition called a status epilepticus. The status epilepticus is a very emergent situation. It can even be life-threatening in some cases, where we have to be careful because normally the brain's mechanism work to abort the seizure on that own. Whenever there is a failure of this mechanism to abort, to stop these seizures, or whenever there are some mechanisms going on inside the brain which are causing excessive electrical discharges with repeated seizures, this status epilepticus occurs. So this can have a very, very devastating effect on the brain's functioning afterwards. So it is important to note if there are recurrent seizures without any regaining of consciousness, or if a single episode is lasting for more than 5 minutes, or if after the seizure episode has stopped, the patient has still not become conscious, or if the patient has still been altered, disoriented, confused for more than 15-20 minutes, this is something which we have to be worried about. This is not a normal, not a common type of seizure. If there is any persistent breathing difficulty even after the seizure stops, it is an emergent situation. If there are some injuries sustained during the seizure, so seizure sometimes can be very violent episode. So if the patient is in a cramped up space, sitting near some furniture, near some glass furniture, near some sharp objects, unfortunately, these are the times when this seizure patient can have a injury, which could be a head injury, it could be a blunt injury, it could be a penetrating injury of some glass around. So if there is any injury during the seizure episode, it is an emergent situation. You have to recognize this and take the patient immediately to the nearest hospital. Or if there is any persistent uh, jerking, even after the patient has become conscious, but there is only one limb which is still continuing to be jerking. So it is an emergent seizure. The seizure has not stopped. Probably the type of the seizure has changed from a generalized seizure to a focal seizure. So it is an emergent situation. We recognize such a situation. If the patient is already a known epileptic, but you realize that this was a different type of seizures than the usual type of seizures that the patient was having. This was a new type of seizure that the patient has had. It is an emergent situation because the character of the seizure in this patient has changed. And most importantly, if it is the first ever seizure episode experienced by the patient. First seizure in any person is an emergent situation. If the patient has never had a seizure in the past, this is the first episode you recognize, then it is an emergent situation. Take the patient immediately to the nearest hospital. In the hospital, when the patient is taken, there are a few tests which will be done. There will be routine blood workup which will be done to check for any metabolic parameters which has caused the seizures like sodium, potassium, calcium, magnesium, or if required, we might also have to do a brain scan. So a neurologist is the right person to consult in such a situation. When you reach the hospital, a brain scanning will be done, brain imaging. Now it can be a CT scan or it can be MRI depending on the patient status and depending on what is the suspicion which is causing the seizure. The next step of evaluation could include something called as EEG. Just like the ECG, which is the heart's rhythms recording, the brain's rhythm recording can be done with the test called as EEG. Sometimes detailed evaluations are required, like the brain fluid, which is called as CSF, which will be needed to be tested. So emergency treatment has to be started beforehand. So the cause evaluation can be done later on. So whenever the patient reaches the hospital in such a situation, the focus is to abort this recurrent seizures or to stop one seizure, which is a very longer episode. After that, the evaluation goes on parallelly to find out what is the cause, because accordingly the treatment will be monitored and tapered accordingly later. Let us talk about what can be done when you observe some having such an emergency of a seizure going on. So very important to know. Don't go by whatever the Bollywood films or the other things which are being shown frequently. That sometimes there is a myth that people cut onion and put it near the nose, or some particular type of a footwear, or some where various other myths are going around. No. So like I told, 90% will stop on its own. You don't have to bring anything near the mouth or the nose of the patient which is going to actually stop the seizure. So if it does not stop, it is an emergency. Take the patient to the nearest hospital. There are now newer forms of anti-seizure medications which have come up for such emergencies. So there is something called as a nasal spray of one particular type of anti-seizure medication, which has come up, which can be given in the nostril, a few puffs here, few episode, any repeat seizure, or which will help to avoid such a prolonged seizure episode. Whenever you find such a patient who is already seizing, don't try to restrain the movement, because restraining the movements can actually cause fractures, because these are very violent movements happening. So if you restrain this body is going to still go on jerking, and that can cause fractures in the limbs of such a patient. Do not insert anything inside the mouth. No spoon. No, you should never put your fingers inside the patient who is already seizing, because first thing, it might injure your own fingers. The patient might bite your own fingers. The breathing of the patient. Do not insert anything. Some patients have told me that they have put a handkerchief or a napkin inside the mouth. Do not do that, because that can in fact block the airway, and that can cause breathing difficulty or lack of oxygen to the patient. Loosen the clothes of the patient who is actively seizing. If there is any tight neck wear, or if there is any tight clothing around the neck, loosen that, because in this jerking movement that can actually cause blockage of the airway or the blood vessels over here. So look around the patient, the surroundings. If there are any articles which can actually cause injury to the patient, try to get those articles away. If the patient is on the edge of the bed, at least get it on the center, or if you have help, get the patient on the floor. That is the best place. Move the furniture around. The patient should not have any injury. Move the sharp objects from the scene around the patient. Okay. So turn the patient on one particular side, whether it is left or right side, on one lateral side, one side of the body should be there, so that whatever secretions are there, the oral, the nasal, the throat secretions are there, which will drip down from one angle of the mouth, so that it will not accumulate and further cause obstruction to the airways. And like I told you, do not attempt to uh, do anything physically to the patient to avoid the seizure. The seizure will either stop, or if it does not stop, take to the nearest hospital. So this nasal spray is one thing which can be given in such an emergency, so that it will prevent any further episodes. And if you have help, if you are not alone with the patient, if there is someone who is already taking care of the patient, be vigilant of the type of the seizure, because this is going to help the neurologist who is going to treat your patient. So make a mental note of what kind of the movement the patient is having, which side of the body the patient is moving. If it is only one side, right or left, whether the head has turned on only one side, which is right or left, whether there was any uprolling of the eyes or not, whether the patient is having any tongue bite, any frothing from the mouth, any bleeding from the mouth, whether the patient has already passed any urine or motions in the clothes. So all of these points are actually going to help decide what kind of treatment is going to suit your patient the best. So be alert, be vigilant, but you should do this only if you have help when someone else is attending the patient. If you are alone, then the priority is the patient. Attend the patient. Whatever note you can make a mental note of all of these things, but till that time, attend the patient first. So the emergency treatment part we can cover further later on in another video clip. But like I told you, beware of these kind of situations. Understand what is an emergency. Understand what are the emergencies in epilepsy, and accordingly recognize those, help these patients. So let us understand whatever I've told you today. Create and spread this awareness amongst yourselves, amongst your peers, amongst your family members, amongst your known epilepsy patients, and let us help these patients to live a seizure free life, a very normal life ahead. Thank you so much for listening to me. Thank you. Take care.